Well, I associate myself with all of the remarks that have already been offered here today. I'm so grateful for the truth telling that has occurred on this dais today and for the historical contextualizing. And I wish to thank Senator Harris for her leadership and her partnership, and Representatives Underwood and Adams, respectively, for their leadership, for their vision, and for their vigilance. I'd also just like to take this moment to underscore the importance of representation and the power of the Congressional Black Caucus. I just want to affirm that as well in this moment. I ran for Congress, like my brothers and sisters in arms on this stage, to lead and to legislate on those issues of care and concern and consequence, to advocate for those ignored, left out, and left behind. And for decades, the pain of Black women has been delegitimized by our healthcare system. I never had the privilege of knowing my paternal grandmother, Grandma Carrie. She died giving birth in the 1950s to my father's youngest brother. And my father tells the story of after 2 days after Mama had left for the hospital to give birth to his little brother, who would later be named Jerome, he asked, "Where is Mama?" And he was told, "She's not coming back." And it changed the trajectory of my father's life and his 4 siblings. And so it is devastating and sobering that it has taken us this long to get here. Again, I'm grateful for the vigilance and the leadership of my colleagues previously named, but I also want to recognize and just thank all those families who have been impacted, who even in the face of their trauma and their devastating losses, continue to amplify their voices. And that is really why this work is happening today on Capitol Hill. We have a mass incarceration crisis in this country, and women represent the fastest growing population, and also the most overlooked. 80% of incarcerated women are mothers, and 5% of incarcerated women arrive at prison pregnant. These women are usually most at risk for maternal health complications, denied critical bonding time with their newborns, and face physical and mental health complications exacerbated by inadequate health care. The Justice for Incarcerated Moms Act would help to change that by creating systems to protect the health of incarcerated women and list them as partners in our fight for justice and equity. I do want to take a moment just to commend a longtime champion in this space, the chair of the Congressional Black Caucus, Karen Bass, who has been championing the dignity and lifting up incarcerated women and girls for a very long time. I also want to acknowledge a leader and a champion from my district, the Massachusetts 7th, Andrea James, who heads the National Council for Incarcerated and Formerly Incarcerated Women and Girls. Several weeks ago, in my floor statement on the ERA, I quoted Audre Lorde, and I said, "I am not free while any woman is unfree, even when her shackles are very different from my own," unquote. And I received some public flack for that. People thought I was being dramatic. But those shackles were not simply a metaphor. There are quite literally still women in shackles in this country. The Justice for Incarcerated Moms Act would encourage states to ban the shackling of women during labor and delivery by tying it to federal funding. Shackling is a barbaric practice, and its eradication must be standardized across the board. It would establish models of care to make sure pregnant, parenting, and postpartum women have access to doulas and other perinatal providers, substance use and mental health treatment, and reentry supports, so that when these mothers go home, they are physically and emotionally able to provide for their families. Additionally, women in prison are often survivors of domestic abuse and sexual assault, and you cannot treat trauma with more trauma, and that's what prison is. The Justice for Incarcerated Moms Act would make much-needed investments in diversion programs as alternatives to incarceration so that more women can remain home with access to community-based services and treatment. Diversion programs work and are promising vehicles to reduce our prison population. We must replicate that success at every level of our criminal legal system. I also believe that which gets measured gets done. And this bill would create the first ever comprehensive study on maternal health outcomes in jail so that we can begin to understand the fundamental issues women face while incarcerated and take the steps needed to address them. Thank you, and again, it is an honor to be here on this historic and momentous occasion. And now I would like to introduce my sister in service, Representative Gwen Moore.